comfortable being off camera, that's fine. But I would like to start with, rather than like an icebreaker, which is what we usually do, if we could just do a quick around the circle, everybody maybe just introduce yourselves, maybe give your name, what grade you're in, and a favorite article of clothing to share. Okay, so I'll begin. So I'm Linda Judah, and my favorite article of clothing currently is my new overalls that I got. It's kind of one of the few items I bought this year being in quarantine, but it's nice to have something that fits around my middle. I've put on a little bit around the middle, eating all the bread and goodies I've been baking while I've been sheltering in place. All right, Olivia, since you're on camera, why don't you go next?
I'm Olivia. I'm a junior, and for an article of clothing, I'm not really sure. I wear a lot of like my dad's jumpers and sweaters and things, so I wear those a lot, and they're probably, I'd say those are my favorite, just any sort of jumper or sweater.
Nice.
Yeah.
Anyone who wants to hop in and be next.
I'm Megan. I'm also a junior, and I'd say my favorite article of clothing is like hoodies, particularly oversized.
Hi, I'm Elitis. I'm also a junior. Right now, my favorite article of clothing are these fuzzy socks that I wear almost every night that I can.
Yes, the fuzzy socks.
My name's Sadie. I'm a freshman, and I think currently my favorite article of clothing is probably just like sweatpants. I've been wearing them all the time now.
Nice. And Julie Wagstaff.
Well, I'm with Elitis. I have to say warm fuzzy socks are my favorite. Absolutely, especially during quarantine.
Awesome. So just as a brief introduction, so Julie Wagstaff has joined us today. I invited her to come and share with us what it's like to be an eye doctor. She is also a Petaluma High School alumni. So thank you, Julie, for joining us.
Yes, you're welcome.
So maybe you could tell us just briefly a little bit about your path to your profession. How about that?
Okay. So I started at Petaluma High. Back when I was there, I actually was the president of the Future Teachers Club. I thought I was going to be a teacher. And then I went to Sonoma State for a couple of years and started taking more science classes and found that I was a lot more interested in science than I was in English. Originally, I was going to be an English major. And then I started becoming more interested in medicine as well. I started wearing glasses when I was 4. So I always thought my eye doctors were really cool. They were really nice people, and I thought it was neat what they did. So I ended up deciding to be an eye doctor. I would have been happy doing pretty much anything medical, really. I thought of maybe being a pediatrician or a nurse, different options, but yeah, I love being an optometrist. So I was at Sonoma State, and then after my first 2 years, I kind of used Sonoma State as like a JC just to get things out of the way, deciding where I would go after that. And after I looked at a lot of different schools, it turned out that at the time, I don't know how it is now, but at the time, Sonoma State had one of the highest acceptance rates to medical schools if you were coming out of their biology or chemistry program. And so I decided to do a biology major and chemistry minor at Sonoma State to stay local, save some money, not spend money to live, I could still live at home, ride my bike to Sonoma State. And then from there, I applied to optometry schools, and Berkeley seemed like the obvious choice. It's close, but at the time I was also working for a local doctor who also happens to teach at UC Berkeley School of Optometry. And she said that if I was her daughter, she would not recommend going there because she knew that I was not a research type person. And Berkeley at the time was very research heavy, even in medical school, optometry school. So she suggested to find something more clinical. So I actually went to Philadelphia. They have a great externship program, and I was really interested in going away. And so they had an externship that was in Alaska. I got to go work with Eskimos out on the tundra for 3.5 months. And then I also got to live in Amish country, Pennsylvania, and do an externship there. And then I did one down in La Jolla, working with kids, vision therapy. So it was I knew that I wanted to go away, not just spend the whole 4 years at the campus. So that's why I chose that school, and it was a really good school.
Awesome. And then tell us a little bit about like a day in the life of a optometrist now. So what are you up to now?
So now, basically, it's really nice. I've been in the same practice now for 15 years. So I see patients that I've been seeing for 15 years. I've seen kids grow up. Like, I still can't believe that they'll come on their own. Like, where's your parent? Like, I drove here myself. I'm in college now. Like, it's crazy. And then, you know, I love having that. That was part of why I wanted to be an optometrist too. Like, being a surgeon, for instance, didn't really interest me because I didn't want to just see someone and see one follow-up and never see them again. I wanted to have that sense of community. So I have people bring me their parents, their siblings, their kids, their coworkers. So it's a real good sense of community. And after all these years, like, once you start doing it, you keep up on your continuing education, of course, but it's like the first couple of years I would second guess myself, like, am I right? Did I make the right diagnosis? And now it's everything. I just like know what I'm doing. I know what it is. It's easy. If it's something that needs to be referred, I refer it. We do find a lot of, like, last year we found 3 brain tumors just in our patients, and it's very commonly we'll find diabetes. So we're not just prescribing glasses and contacts. It's a healthcare provider, and we have to funnel people into the appropriate care once we diagnose something.
Awesome.
But yeah, go ahead.
I was just going to ask, so how has your practice shifted and adjusted with COVID-19?
So we were closed for 2.5 months initially. Everyone just shut down. We waited for CDC guidelines and American Academy of Optometry guidelines. We just, wanted to keep everyone safe. And then once we came back, I mean, really, we already had all the cleaning protocols in place, so that didn't really change, but we did not used to wear masks. Now I also have a fan that's on the floor that directs the air between me and the patient, takes it over there. So even though we both have our masks on, the air is still going this way. If we have a patient come in with like a loose bandana as a mask, we have them replace it with one of our surgical masks. And we also close earlier, and every 3 patient slots we actually block off just to make sure that we don't have too many people in there at once. We no longer let people bring family members into the office. No one can be in the waiting room. People just have to come in on their own unless they're with a minor. So that's changed, not as many people in the office at once.
And have you and your staff been able to get vaccines?
Yes.
Fantastic.
Yeah.
Awesome. So I know we have just a little bit of time with you, so I could ask you questions all day, but I want to open it up to our students as well to see if any of them have questions. So if any of you have questions for Julie, please chime in now. You can either just ask your questions to her, or if you want to drop some in the chat, that's okay too. I'm happy to read them if you would rather do it that way.
How competitive was getting into school in this
that field?
that field, sorry.
Yeah, no, you're good. It was pretty competitive to go to the school that I chose. And honestly, I did not have, the class that I was in was known among the teachers in Philadelphia of being the highest GPA class they've ever had. And I was not one of the highest GPA that they had ever had. I think I had a 3.83 from coming out of college. And, but I was the first person that they accepted because they said that they wanted well-rounded, and they saw that I had always been, like, in high school, I was on student council and I was in sports and 4-H and clubs. And then when I was in college, I was the same thing. And they wanted someone well-rounded, and I volunteered in an optometry office, and then I worked in an optometry office. So they had a sense that I knew what I was getting into. Unfortunately, our class, the reason it came out that the teachers that we had the highest GPA class, one of the teachers actually sat us down. There was like 100 of us, and they said, "You guys have got to chill out." Because you're already here, you made it, you're used to being high achievers in high school and college, you're used to having to have the 4.8 or whatever it is, but you're here, and now the goal is to learn the information and relate it to your patients. Like, you don't have to be competitive anymore. Stop being cutthroat about grades, work together, be in study groups, make it a thing, make it a community. And so it was the first time that they had we lost 7 students out of our class because they could not cut it in clinic. They were so academically focused, they couldn't relate to the patients well enough. And the teachers just said, we can't say that you came out of our school. You can't represent our school. So it was a big deal because it had never happened before. So I would say just, yes, absolutely grades are important, but being well-rounded is really, really important too. Being able to relate to people. And if you are in clubs and activities and everything, you're building those social skills. So just keep it well balanced. That'd be my biggest piece of advice. And it makes you happier too. And you create good memories. You're not just remembering that you're studying all the time.
Nice. Any other questions? Speaking of well-rounded, Julie, I know that you did some work with like volunteering your time to do eye clinics. Was it down in South America or was it Central America?
Yeah, I went to Chile, Dominican Republic, and Thailand. And
can you talk a little bit about that and how you got involved in that?
Yeah, it was actually through the company that I was working for. They have, of course, they're not doing it now with COVID, but you would go for 2 weeks at a time. And for months ahead of time, you would be collecting glasses. All of us, all the doctors, all the staff, everyone who was going would be collecting glasses. And my dishwasher would be full of glasses people had given us. And then we had to neutralize and figure out what the prescription was. And then we had boxes and boxes that we would send ahead of time that were labeled men's, women's with what the prescriptions were. And it was all entered into a computer system. And then the local Lions Club of wherever we were going had it all set up. It was really, the first one was in Chile, and it was just amazing to see. We came in on a bus and just the line of people that had come over the mountain overnight. They were just sitting, it was freezing cold. And they just, they had sent out word, and none of those patients had ever had glasses before. And it was really eye-opening to see how, I had traveled internationally before, but not to developing countries where you see like people would come in and they're a cook or they do crafts because that's all they can see. They can't see far away. They have to do things that are up close. Or people would get into farming because they could just see far away and they couldn't see up close to do crafts and cooking. And so it was fascinating to see how people entire lives were formed by what they could see or not see. And then they were so happy when they got their glasses. We would give them a case, and then they would just be thrilled. And as the doctor, you're mostly doing the exams, so I didn't get to see it that much. So whenever I had a break, I went over and volunteered, and like, you guys all start handing out some glasses just to see the big smiles. And then so many of them would just take the glasses off their face, put them in the case, and then walk away. They were so worried something would happen to them while they were on their face. They just wanted to hold them until they got home. It was really amazing.
Wow. And so I believe, so in the past, I know you've told this story to me before, but I wanted you to share it with the others. What were the days like? They were pretty long, weren't they?
They were long. Yeah, it was, you barely sleep. You're up at the crack of dawn. If you're not staying near where you're giving the exams, like they would find coliseums, or they would just find even fields. We'd be out in the fields, like near rice paddies in Thailand. And so we had to bus in. I was the only doctor on that one that was willing to camp out there, so I was already there. But you'd have breakfast at like 6, and then you'd start seeing patients at 7, and then you would be until, you saw everyone who came. So if you were there till midnight during exams, you were there till midnight during exams. And then the locals would feed you, which is amazing. It's just, like I'd never had goat before. You eat whatever they're going to serve you, and then you sleep for a couple hours and get up and do it again.
Wow.
Really rewarding. And
how do you feel that kind of experience informed your current practice?
Now I do a lot of free exams for the community. So like during the fires, I would put word out there. We had so many patients that lost glasses and contacts and everything in the fires. And then we also hook up with Lions Club and also Face to Face, which is an organization for AIDS patients, and a couple other organizations that get kids in. And yeah, just giving free eye exams.
Awesome. So we have a few more students just joined us. So again, just to reiterate, we have Julie Wagstaff, Dr. Julie Wagstaff here with us today, sharing her experiences as an optometrist, excuse me. We are recording this session. So just as an FYI and a reminder, if anyone who has shown up just recently would like to see the earlier parts of the conversation, I will be posting this video in a little bit. So again, just opening it up for Julie Wagstaff. Any questions that you have? We've got a little bit more time before she needs to run off to the cross-country meet. So if any of you students have any questions for Dr. Wagstaff, feel free to chime in or to drop those questions in the chat. One question that I've heard asked of other guest speakers that we've had was, which classes at Petaluma High do you think were especially helpful to you in your studies further on?
So back when I was at Petaluma High, it was the only honors classes available were English. I think there might have been a math, and then it was the first year that they had advanced biology. So it was before all of these other honors and such classes, but I did take the honors bio, and absolutely it helped. You know, once you go down the road, the more you hear things, the better, the more it sticks. I also took chemistry, so that absolutely helps since I was a bio major and a chem minor. Anything you can be introduced to early on just helps you when you get to college. It's kind of, it just makes that class easier, reiterates it.
Awesome.
Yeah. But again, at the time, I didn't know I was going to do this. I thought I was going to be a teacher. So I wasn't really focused on this path. Yeah. Which is the great thing about them requiring you to do those first 2 years in college and just being exposed to what's out there. I mean, someone like my husband, who's also a Petaluma High grad, he was an anthropology major and went to Guatemala and did digs, and then he thought, like, that's cool, I did that, and now I'm going to become an electrical engineer. So you just never know what you might change into. Yeah.
Here's a question for you. So I've been seeing on social media a lot of people posting that they've been matched. So a lot of people going into different types of medical professions right now. This is the season apparently when they get matched to do their internship. So their intern portion. And I'm curious, do you in your practice have interns, or is that something that only happens at hospitals?
I think it's usually what happens with hospitals. Like when I did my internships, it was always through, well, Alaska, of course, it was actually a military hospital in Alaska. It was usually through a big surgery center or a hospital. I never did a private practice. Yeah. And it's usually with doctors who either went to that school where you are going to, or that live nearby, and they maybe come in and teach a little bit too.
Mm-hmm.
Yeah.
I'm going to pause I still have a million questions, but I'm going to pause myself again and encourage any of you students, if you have questions that you'd like to throw out, please feel free to hop in.
Did you go to like the normal like 4-year medical school and everything?
So optometry school is, you have all the same classes the first 3 years, except you also have physics. So like my brother was doing medical school at UCSF at the same time, and we had a lot of the same books. We were taking the same classes, but we also had physics. So it's pretty much the same thing at first. And then once you get to that 3rd year, you kind of veer off and we're more optometry related, and they're doing like all the general things.
So Julie, you mentioned you started at Sonoma State, and that Sonoma State had a really good success rate as far as people transferring. So what do you know about Sonoma State's current programs? Do they still have a strong like pre-med program there? To your
You know, I
knowledge?
really don't know. The head doctor of the chemistry department and the biology department when I was there, they are no longer there. So yeah, I honestly don't know. I don't know how much it was tied to them, but yeah, I mean, even when I was there, I was surprised to find that they were in the top 10 of state schools to get accepted to medical schools. It's like, okay, well then I guess I don't need to go anywhere else. I'll just stay here. But I don't know honestly what Sonoma State focuses on now. I don't know.
Yeah, I know they have a really strong nursing program, but I'm not sure. I wasn't sure about their other programs.
Okay.
And then our JC, I know, has a number of health profession kind of concentrations, dental being one of them. Do you have any knowledge of what's going on at the JC?
Well, I know they don't have optometry. For optometry in California, you'd go to Berkeley, or you go to, there's one school in Southern California. At the time I was applying, there were, I think, 16 schools total in the whole country that were for optometry.
And is that considered a graduate level? Is that after undergraduate?
Yes.
Yes.
Yes. So you have to get a bachelor's first.
Right.
You have to apply already being done with, the 4 years, and then you get and then when you're there, you get a second bachelor's. It's called a bachelor's of vision science, just because you take so many physics classes and such. And then of course you get the doctor of optometry at the end.
Awesome.
Yeah.
Other questions?
Do any of you know what you want to go into, or are you kind of keeping it open?
I'm kind of trying to keep it open right now. What's been interesting me recently has been veterinary sciences, but
Yeah.
I've also I've gone through like nursing phases and even like surgeon phases, but right now that's kind of what sounds the best to me.
Nice. That's great. And Davis is great for that.
Yeah, that's my first choice is Davis.
Nice.
I think I might want to become a doctor. I'm not sure what kind yet, but I applied I'm a senior, so I applied for kinesiology as my major for all my schools.
Oh, cool. That's awesome. Yeah, that's a great major. You can do so much with that. I remember my human anatomy class when we dissected cadavers. I was the only one in there that was not a kinesiology major. Yeah, they were all wonderful people.
What question should we have asked you, Julie, that we haven't asked you yet?
I think you're all great. I guess. I don't know if I would have known what to ask.
Here's a question. So you have your own private practice now. What was that like, getting into private practice?
So that was something that, yeah, if you ever think you're going to go into any type of owning your own practice, business is a big component that I had no experience with. My parents didn't own businesses. I had no business background at all. So that part was a bit daunting and honestly really stressful, just going through the whole process of becoming incorporated and doing all of the insurances and just everything that came with it. Now it's totally fine. It's rolling on its own. And I know a lot of people who do have their own businesses and help me, fortunately. But yeah, that part was, I just like to see patients. That's my passion, is seeing patients. My passion is not the business part.
Nice. Well, Julie, I see it as about almost quarter after, and I know you do have to get off to the cross-country meet. So I just want to thank you again on behalf of all of us at HOSA for coming and joining us and sharing with us today. And if anyone has questions that come to their mind afterwards, or folks who maybe watch the video later and have a question, is it all right if I share your contact information with our students so that they can reach out to you if they want to find out more?
Sure.
Awesome. Thank you so much. All right. Well, thank you, Julie. Everyone else, if you want to stick around for a little bit, we have a couple of things to chit chat about, but we'll say goodbye to Julie Wagstaff for now.
Thank you. Bye.